Welcome to Eye Contact. I'm Martin Severinsen. Stress is part and parcel of the life of the ophthalmic surgeon. The normal stresses of day-to-day life and the challenges and problems in the typical day in the OR can combine to push surgeons into the red zone. Today I'm talking with Stig Severinsen and Stefan Palkovits on strategies for dealing with stress. Stig, first of all, what are the signs of stress and can it be quantified?
Well, there are many ways to measure stress, but a very simple way is looking at your breathing rate. So how many times they're breathing per minute? Many people breathe through the mouth or start to speed up breathing when they get stressed. That leads to the production of stress hormones such as cortisol and adrenaline, and that has many unwanted side effects. So simply looking at your breathing and your heart rate are very strong indicators of stress levels, and it's something that can be easily corrected.
So Stefan, how can we learn to recognize the early signs of stress and how can we deal with this?
I mean, the early signs of stress are often you feel a tension inside. This kind of stress or this kind of stress level is not always pathological, as you need some kind of tension, for instance, before you enter the OR. Though when it happens that during the surgery there's some kind of complication, what you realize then is suddenly, out of a sudden, you feel your heart beating, your breathing rate increases, and this tension somehow starts to overwhelm you. And that is, of course, a sign when it happens that it enters a pathological range of stress.
Stefan, there is a physical component where posture and body position plays a role. Any suggestions there?
I mean, when it comes to cataract surgery, for instance, or to surgery in general, you have the one component is the thing which is going on into your mind. So you know when something happens, you know the consequences, you know what the patient would say afterwards. So this is a stressor which is in your mind. The other thing, as you mentioned, Martin, is the more physical component when you are in a non-relaxed body position. For instance, set up at your microscope, like somehow moving and turning your body, crunching down. Of course, this is an additional stressor as you start to feel your body when you keep this bad position. And a second thing which happens is that you cannot breathe normally, for instance. You cannot move because all your muscles get tense, and this adds an additional stress in this situation.
Stig, are there any breathing practices and so on that a surgeon can employ on a regular basis to keep mental and physical stress at bay?
Absolutely. The breathing is easy to control once you train it. So once you start to realize that a slow exhale will trigger the vagus nerve, which again lowers the heart rate, that gives you the physical, the neurophysiological relaxation. Then Stefan was mentioning also body position, the way that you kind of sit up straight, shoulders a little bit back, open the heart, open the lungs, so you can actually breathe naturally. And then also the most important part, besides of breathing, is relaxation. It's so overlooked, but as soon as you tense your body, you also tense your mind. It's like a parachute collapsing. But with the breathing and relaxation together, you create the best opportunity to have a successful surgery.
Stefan, let's not forget the patient who is also experiencing stress. What can we do to help there?
When we look into the environment of a surgeon, the patient is the central piece where we have to look after. And when we have a patient who is anxious, for instance, or starts moving during the surgery, this leads to a stressed surgeon as well. So we need a calm patient, and when we have a calm patient, a calm environment, we have a calm surgeon. And there are certain things we can do to calm down our patients. So I think one of the most important things is we need to talk to the patient and we need to use a language which the patient understands. And so the patient can follow the procedure, the patient knows what is going on and accept any circumstances which might occur on the way during the procedure.
Thank you for joining us. For more information, please visit us at eurotimes.org.